Well, with COVID-19 cases spiking, infectious disease expert Dr. Zain Chagla joins us again on Morning Live for more pressing questions. But first, we got to talk about Donald Trump and the First Lady. Good morning.
Good morning.
So, kind of a shocker this morning, and it's taken over the Twitterverse and beyond. We were mentioning before the break, Donald Trump, he's 74. That's a high-risk age, even though we learned that he's doing well this morning.
Yeah, I mean, it looks like based on the case tracing, this is probably very early in this disease or kind of that pre-symptomatic phase. So it's still unclear what his trajectory is going to be. As you said, the risk of death in this population over 74 and obesity is probably 5 to 7%. Risk of hospitalization.
So
whatsoever, we hope that he's on the good side of this.
But it's certainly something to watch closely.
Yeah, for sure, for sure.
Yeah. Rapid testing, the Abbott ID Now test has been approved by Health Canada, and they've bought a bunch of these units. This isn't a silver bullet, though, is it? I saw that you tweeted that there's some serious limitations to this rapid test. Can you explain?
Yeah, so this test, when it's been used in the United States, has missed some positives. The irony in the news today is this is the same test the White House uses, too, to test its staff regularly. So,
oh, really?
Yeah. It has to be applied in the right setting. So this is not the test to be necessarily testing people that are symptomatic showing up to an emergency room. But if you're going to use this in, say, an Indigenous community where the turnaround time is 14 days to get a real lab test, or screening of people going into long-term care where the risk is actually relatively low to have COVID-19, it works really well. But if you're going to use it for people who are symptomatic, you have to interpret it in the right context. And yeah, you might miss a few cases, like unfortunately in this scenario.
Yeah, so it's just another tool. But I remember earlier in the spring, there was that company out of Ottawa, Spartan, that had a kit, and it was deemed ineffective later in the summer for the same reasons. It just wasn't catching enough.
Yeah, again, all these tests have to be picked out in terms of their characteristics, and they're going to work in certain places. Often how more rapid the test is may actually compromise how effective it is, and you just have to apply it in the right place.
Yeah. Since we last spoke, there are some early studies, not peer-reviewed, but it has been reported that there may be a newly mutated strain of coronavirus and a more contagious strain.
Yeah, it's a controversial amount of literature. We know viruses always mutate. This is part of their RNA. It's unstable. They collect mutations. They looked at the U.S. samples over a set amount of time, and they saw that there was some mutations. It's interesting, if you look at other data sets, that mutation was actually there in March. So, the hypothesis is, with masking and everything along those lines, the virus mutated to be more contagious. In reality, there might be some change in this virus. Whether or not it meets its more infectious is still very controversial, or if this is just the natural change that we see in viruses. So, it's still very controversial literature. It's something to keep an eye on, but I don't think it changes anything significant.
Okay, let's talk about assessment centers certainly being overwhelmed. They've added hours in Hamilton. Can you speak to the changes?
So obviously there's a huge amount of demand for testing, and we need everyone who's symptomatic, who fits the provincial criteria to get tested, both for children and adults, which have changed. Please look them up. If you fit those criteria, consider getting tested. The City of Hamilton and St. Joe's have launched the Hamilton COVIDtest.ca website, where you can actually book a center, which helps streamline people to the appropriate assessment centers. They've added extra hours. So please, as part of your public health duty, if you are having symptoms, stay home, book a test online, go for the test, and isolate afterwards while waiting. So I really encourage folks to go to the website as it really has helped streamline people to get testing appropriately.